In this clip, we're going to look at the key signs of good health and welfare in young lambs and look at treating some common conditions that may arise. The key signs of good health and welfare, which will be familiar to most people, are the general demeanour of lambs. Are they bright, alert, responsive, or are they quiet, dull, depressed, miserable? A good sign of a full belly of milk or colostrum is when a lamb stands and gives a good stretch. Standing ability of young lambs is a good indicator of health, whether they stand squarely in four legs or if they've got any signs of wobbliness or recumbency, which can be an indicator of hypothermia, starvation, or conditions such as joint ill. As well as demeanour, the general posture of a lamb can tell you a lot about it. So is it relaxed? Does it have a tucked up abdomen? So hunched tucked up posture can indicate signs of abdominal discomfort, starvation, or hypothermia. Looking at the abdominal fill of young lambs can tell you whether they've had a good belly full of milk, or do they have a hollow appearance indicating that there's a lack of milk or colostrum. On the other end of the spectrum, you can get lambs that appear very, very bloated. Frequently they're seen in orphan lambs when they've gorged on the milk. The gait and general appearance of the joints of lambs can tell you a lot about their health and welfare status. Do they walk freely, or do they have a stiff gait and enlarged joints, which may be suggestive of joint ill? Other areas to assess would be the mouth and eyes. Firstly, for signs of salivation, excess salivation, which can be a sign of watery mouth, and not the frothing of milk that can occur after a bottle feed. Examine the eyes for any evidence of tear staining. Does the lower eyelid appear to roll inwards in the condition known as entropion? And is there any cloudiness, whiteness over the surface of the eye? Most of the key signs we've covered so far have been based on very physical aspects of health and welfare. But there's a really key sign of health and good welfare in young lambs, and that's play behaviour. These signs can clearly be used to identify good health and welfare in young lambs, and also those lambs that may require treatment for particular conditions such as hypothermia, starvation, joint ill and entropion. Next, we're going to look at some of the ways you can treat these conditions. Let's take a close look at hypothermia. Clearly, a lamb that's shivering in front of you is easy to spot as a cold lamb. But for those cases where you have a dull, tucked up, hunched posture or flat out lamb, it's useful to take the temperature there. The normal rectal temperature of a healthy young lamb is between 39 to 40 degrees Celsius or 103 to 104 degrees Fahrenheit. A lamb with a rectal temperature of 37 degrees Celsius or below would be classed as severely hypothermic. These lambs are often flat out and comatose. The way that we treat hypothermia in young lambs depends on the age of the lamb. That's because young lambs are born with a brown fat supply, which is essentially their energy supply for the first 5 to 6 hours of life. So, for lambs aged 5 hours or below, we use its own brown fat as its energy supply and warm the lamb up first. For warming up lambs, it's preferable to use a warming box which heats up the air around the lamb and is a more efficient way of heating rather than using a UV lamp which can overheat, dehydrate the lamb and can scorch lambs. So if you do use a UV lamp, check the height and check that lambs can move out the way and are not too hot. Once the lamb is warmed up, remove it from the warming area and place it either in a hospital pen or back with the ewe for closer observation, and then stomach tube it with colostrum. So just a quick refresher on stomach tubing. Stomach tube the lamb in as a relaxed and natural position as possible. Try to avoid stretching the neck out too far, as this can encourage the tube to go down the windpipe, which is obviously what we don't want. A useful tip, particularly for smaller lambs, is to measure from behind the elbow to the tip of the nose the length of stomach tube that you need to insert, just as a rough guide, because often that's quite long for a smaller lamb. It might be useful to keep a set of stomach tubes in a pot of warm water, just keeping them soft and pliable, and you can lubricate the tip as well before inserting them. A last little tip is a lot of the baby feeding equipment equally applies to young lambs, and the bottle warmers and baby sterilising solutions can equally be applied for using on stomach tubes. As a general guide, a lamb requires 200 ml per kilo of colostrum in the first 24 hours of life. If in doubt, you haven't seen the lamb suck colostrum in the first 2 hours or it's appearing hollow, then administer 50 ml per kilo by stomach tube. For lambs older than 5 hours old, we need to give more aggressive treatment, and that's because we assume that the brown fat supply is being used up. Without this essential source of glucose, the brain struggles to function properly, and the end result is that we have a comatose lamb which doesn't respond to standard treatments of stomach tubing, colostrum milk, or warming in the warming box. For these lambs, the technique of intraperitoneal injection or IP injection really can be a lifesaver. Essentially, the technique involves administering a warm glucose solution into the peritoneal cavity, and this is the space between the intestines and other vital organs in the abdomen. This is a good way of getting glucose into the lamb as it's rapidly absorbed from the peritoneal cavity. It really is a do or die procedure and is an emergency lifesaver for those lambs that are comatose and flat out. The IP injection, you'll need a bottle of 40% glucose, also called dextrose, recently boiled water, and a needle and syringe, and I'd recommend using a 19 gauge 1-inch needle. Draw up 10 to 50 ml of recently boiled water and an equal volume of the 40% glucose to make up a 20% glucose solution. I'll demonstrate the IP injection using this model lamb. So hold the lamb by the front legs. By doing so, the vital organs will move away from the area you want to inject into. To identify the correct position, find the navel and work 1 inch below and 1 inch to the side. Either side's fine. And we're going to place our injection in that site, aiming downwards at a 45-degree angle towards the tail. And then you're going to insert the needle right to the hub and inject slowly. And here's where the landmarks are on the live lamb, 1 inch below and 1 inch to the side of the navel. Following the injection, place the lamb in the warming box, and as previously, once it's warmed up, give colostrum by stomach tube. If you're not completely confident after the demonstration, then have a go at practicing on a dead lamb or maybe a toy lamb. For lambs over 5 hours old that are mildly hypothermic, they can be given colostrum by stomach tube and then returned to the warming box. For lambs with watery mouth or diarrhoea, in addition to any treatments recommended by your vet, be aware that these lambs often have considerable damage to the intestines. Therefore, stomach tube and electrolyte solution first, and then give milk feed several hours later. Lambs such as this one with joint ill require antibiotic and anti-inflammatory treatments as directed by your vet. Navel dipping can be an important part of preventing joint ill. In addition, we know that the common bacterial causes of the condition are found in the environment. Therefore, as well as maintaining optimal hygiene conditions, it's important that lambs receive a really good supply of colostrum. The final condition we're going to consider in this clip is entropion. It's a condition which lambs are born with, whereby the lower eyelid is turned inwards. So check the eyes of newborn lambs for these rolled in eyelids. In older lambs, you might notice some that are holding their eyes tightly shut, or with tear staining and eye discharge. And all of these can be indicators of this condition. You can imagine just how painful it must be to have the inner eyelashes constantly rubbing against the front of your eye. Therefore, it's important that we treat and try and prevent this condition too. It's possible that entropion is a genetic condition. Therefore, along with lamb performance records and other flock records, you might identify a particular ram involved to try and prevent this condition reoccurring next year. So a case of entropion like this, where you've got turning in of the lower eyelid, there's two main treatments available. So one option is to give a subconjunctival injection, which is essentially putting a bleb of a substance such as antibiotic like penicillin, which is quite oily, or another oily based substance such as liquid paraffin into the area here to pull on that lower eyelid and turn it out. So you're going to put your needle parallel to the eyelid and you're aiming for this skin here, and you're just going into the skin and underneath like so, and just going to put a bleb of antibiotic there, roughly about 1/2 ml, and as I do that you can see that that area is starting to enlarge and it's just pulling out that lower eyelid. So we've got another case here of a lamb with entropion, and as you can see, it's holding its eye quite tightly shut. It's got signs of eye discharge and tear staining, and quite clearly you can unroll that lower eyelid. So we're going to demonstrate an alternative method of treating entropion, which, as you can see, can be done single-handedly, and that's the application of the Michaels metal entropion clips. So just as before, you hold the eye open, invert the lower eyelid, and you apply the metal clip to that excess skin underneath. In less severe cases, a single clip will often hold that eyelid open, but in more severe cases like this, it's useful to use 2 clips slightly positioned apart to hold the lower eyelid. And so you can see that lower eyelid is now rolled out. The clips stay in place until they ping out when the skin under the eye grows.